hip flexion, positional isometrics. So hip flexion that's flexion. Positional isometrics we're using because you have too big a gap between your passive and active range of motion. So what we're going to do is use these positional isometrics as a way to gain control so we can close that gap. So your passive range will stay where it is, but we're getting that active range a little bit larger. So your body will no longer be in that state of danger. So what we're going to do to start with, we're going to get into hip flexion in this position. So really important thing here is I want to keep the knee a little bit bent because as I lean forward to get into flexion here, if I straighten my knee, I'm going to feel a bit of a neurological stretch here. I don't really want that. I actually want to feel, if I can, it in the middle of my hamstring in the muscle belly there. So there's going to be a little bit of playing around to find the right spot just for you. But what's going to happen here is as I do this, I can, if I don't worry about what I do with my hips, I can lean forward and get my chest all the way to my legs. So that's not going to help. So what I need to do here is I'm going to tilt my hips backwards. Imagine you're trying to, whatever, show someone behind you your butt. So we're going to tilt that hip backwards. What that'll do is that'll put that stretch in your hamstring. And I want you to actively hold this position. Got a little bit of a bend of the knee. But now what we want to do is we want to find your active range because we need to know where your starting point is for your positional isometrics. So at this position, once again, here, you're going to need some good balance. So I've got a pole, mobility stick here. You can use a dowel or whatever. And then I've got a wall here. So from here, I'm going to use basically my hip flexors and my quad to lift my leg off. And I can, which means, and I'm going to cramp here, by the way. Your hip flexors are going to cramp. So I'm sorry, kind of actually am sorry about this one. So I can lift off there. But as I slowly come down, here, this is about my active range now. So that's how you find your active range. If I can't lift up, but I can if I move back just a little bit, that's my active range. So if you've got positional isometrics, what this means is you've got too big a gap between that, this is me, this is my active, and as I come down to passive, like this is it. So I've got about a 15-degree gap. What I want you to do is this. Find that spot there, and then just tilt forward a little bit so you're about 10 to 15 degrees past it. So you'll be now in your passive range. If you try to lift up, you won't be able to. You're going to hold still here and you're going to do a pales and then a rails contraction. So the pales is just you're driving the heel into the floor using all of this tissue here. And then the rails is trying to lift the heel off the floor. So you're going to do this probably at 100% intensity. Take a big breath and then drive that heel into the floor, your pales contraction for 10 seconds. 5, 4, 3, 2, 1, and then do everything you can to try to lift that heel off, which I am doing. You may cramp here. 10 seconds. Whew. And then chill. Now your body's going to want to cheat as you do that because it's going to want to help you get the heel off. So as you do it, you're going to tilt the heel, the hips here, as you can see I'm doing that. I can't lift it off here. But if I tilt the hips, I can. Just make sure as you're doing this, everything else is staying still. So that's 10 or 15 degrees past your active range. What you're going to do now is go a little bit more. So we just don't think about leaning forward. Remember, the only thing that matters here is your femur in relation to your hip. So just tilt the hips a bit further forward. And then if you need to lean a bit further forward, think belly button to your thigh. So another 10 or 15 and do another rep. So drive down as hard as you can for 10 seconds. Once that 10 seconds is up, lift up, try. So if you've got positional isometrics, what that means is find your active range, go to 10 to 15 degrees past that active range into passive and do your pales and rails contractions. So 10 seconds down, 10 seconds up at probably max effort, but your program will tell you. Once you've done that, rest. Go another 10 or 15 degrees into your passive range. Do your pales and rails, 10 seconds down, 10 seconds up. If you can, go another 10 or 15 degrees. So you're going to do one rep at each 10 to 15 degree increment from your active to your passive range. So what that means is if you have a 30-degree gap, you'll do 2 reps. So you'll do one at like 10 or 15 degrees, and then your second rep will be around 25, 30 degrees, and that'll be the end of your range. If, however, you have a 60-degree gap, you'll do 4. So it'll be 10 or 15 degrees, rest, go again. So then you'll be at about 30 degrees, rest, go again, 45 degrees, rest, go again, and then 60. So 10 to 15 degree increments as you go. The higher intensity you can do this, the better results you're going to get. This is intensity drives adaptation 100%. The first time you do it, we might program at a lower intensity so you don't hurt yourself and you get used to the movement. But basically that's it. That's your hip flexion, positional isometrics. There are other ways we can do this with a bent knee, but I find this is probably going to be the most beneficial. The only thing you're going to have to figure out is a position that you can get into where you actually find some really, really good balance. But anyway, enjoy. It'll play a huge role. Just quickly, I know we're getting to the end of this anyway, or we finished it, but just really quickly, imagine, as an example, imagine if that's as far as I can lift up my leg actively, but I can actually get it to there. It means every time I like squat, I'm getting into a position I don't have control over, and your body doesn't like that. So the better we can do this, the better you can start getting into ordinary everyday life things without your body feeling like it needs to protect you. Anyway, enjoy your new hips and your lower back pain, or less lower back pain. Not lower back pain, but lower. You know what I mean. Enjoy.